Now we will enter into our Q&A. Thank you all for submitting questions. If I could have all of the panelists come back on camera, and we will begin the Q&A session. The first question that was submitted is to all of our panelists. It says, Hanover County has had several recent suicides of teens. What is specifically being done to address this dreadful statistic?
This is honest. I have no idea. That is not my question.
Well, just like I went through with the Signs of Suicide program, and because the training that we received was in October of 2019, and we were organizing to do our rollout for the county in March of 2020. We know what happened in March of 2020. So we were not able to utilize and really get into the schools to do this SOS training with, our 7th and 10th graders until early this fall and then earlier this spring. So I can speak for, that's what we're doing in our small, portion with all of the school counselors doing this SOS training with all of our students in those grades.
Thank you, Kim. And I'll just add on, much of what we do from Hanover Cares is partnerships just like this event that we have tonight, and just trying to encourage our community to get involved. We know that the schools do a lot and our youth actually get a lot of education at school. But what we found is just that it needs to continue and the parents need the education as well. And so that's much of what Hanover Cares does. You've heard about the Lock and Talk statewide initiative tonight. We promote that alongside the Community Services Board and the CSBs. They also have same day access now. And so we don't have someone on the panel per se that can speak to all of that, but we'll be sure to share those resources with you all as well, just to make sure that everyone's aware. Hanover County has tons of resources. And we just want to make sure that people have access to those resources and that you all can, be equipped to have these conversations at home as well. Let's see, our second question is also for all the panelists, and it's with the recent suicide of elite college athletes, what training can be provided to coaches and parents that helps them understand the need to balance sports aspirations and positive mental health?
So I can have lived experience really quick. I'm not really the suicide professional, to be honest with everyone. I'm the addiction and recovery one, but I do know my son plays travel baseball and he plays basketball and he's in school and he's in advanced math. I know for me as a parent and the coaches that he does have, he's got amazing coaches on his team. They teach him not just about sports, but respect, your time management. Like they teach way more, at least his coaches. It's kind of a Hanover, it's MPH 101. It's not like a Hanover County league. But my opinion on what I think coaches should, and really starts with the parents, to be honest with you, is to try to see where your child is mentally to the best of your ability, because it is a lot. I mean, he's 12 and it's a lot on him. And until we feel like it's something that, it is definitely taken a toll on his mental health, we would stop it. I mean, it just is what it is. I know it's great for college and moving forward, but again, our world has changed and our children are under a lot of pressure. And then you throw in sports and you want to be Steph Curry and there's so many things out there like you want to be. It's really important to you still keep in track of your child, because the coach is coaching 30 kids. It's still your child to try to stay present with, to see how they are, mentally and how their mental health is too, because it is a lot, in the sports and college and all that. That's what my daughter's not even in sports anymore, but the college and having a job, that's a lot as well. So.
Yeah, going off of what Honesty said, I think from just a again, just a more personal perspective, don't be afraid to state the obvious also. It's better to say things than to have left things unsaid. And don't be afraid to say, hey, you don't have to do this if you don't want to. You might get a response of, what are you talking about? Like, of course I do. I'm just stressed out. I just had a bad practice or a bad day. And so really reinforcing, this isn't your life. This is something that you're doing in your life, and leaving so many doors open so that, a child, a teenager, a college student never feels like they're out of options or that they're trapped, can be really helpful.
Yeah, and I would just add lastly, I know Kim and the school intervention counselors, you all do lots of professional development with staff. And so that would include like the athletic directors at our county public schools. Of course, we have Randolph-Macon College in Hanover County. They have a designated substance abuse prevention professional as well. And so again, I think it's just a matter of their resources and things being done. And one thing we probably don't do enough is just kind of sharing, those stories and what we are doing and what's happening. But there really is a lot that's happening. And so I think the more that you all on tonight can get engaged. Hanover Cares is a great way to start that, because we share a lot of that information, trainings that are available in the community. And so just be an engaged citizen. And I think that's a primary start of how you can just connect and learn a little bit more about what is happening. And then if there are gaps, then you'll also have some connections to the right people to talk to discuss those gaps. Our third question is for honesty. Is McShin an option for loved ones to reach out to understand what their family member is going through with addiction and their fight for recovery?
Yes, every Wednesday night we have a family meeting that Moses Wright, he's a CSAC, a certified substance abuse counselor, that does with families. All are welcome, though. It's not just the families of the participants of McShin. It's kind of like an introduction on like what your loved one is going through in early recovery. And he obviously talks about addiction too. But anyone that ever wants to just chat, Octavia, you can give them my phone number, my email, we can set up. You can just come to McShin and see the realness. I always invite people to come see the humans that we serve, because we're open 365 days a week. And like, you can kind of sit in, even in a group, if you would like, with permission, obviously, and just kind of hear some of the stories of our participants, because that is super impactful for family members that, it's just different when you hear all these other stories and see how much is affected. But all of our staff are open to talk to family members to kind of get you to understand. And then there's Family Anonymous. You can Google that. It was one at McShin meeting, but since COVID, I don't think they meet anymore. But Families Anonymous is a good one to check out too. But you're welcome. It's Wednesday around 6:45. Moses does his meeting upstairs on the 3rd floor.
Yeah, and I think one of the other resources I know that Laura had shared in her presentation is bewellva.com. And that's some regional Central Virginia resources. And so I know there might be some people watching or joining us that are not in Hanover County. And so I just wanted to offer that website too. So that way you can also get connected with your local CSB and the resources that they also might have. Another question, this is for Kim. Based on your slides, are there more recent numbers? The comment also states that my child is currently at VTCC with suicidal thoughts. She's in the 10th at Mechanicsville High School, and just wondering if she's absent on those days that SOS occurred or was not honest in her answers.
I can't speak for Mechanicsville High School because I don't know what days. I mean, I could go back and look to see through emails and things, but where I don't work in that corridor, I only did the Western corridor. Signs of suicide lessons, and I apologize for that. I mean, that's something that you could reach out to your school counselor. They could give you the dates as to when they offered SOS over there, but I can't speak to that. And like I said earlier, with the 2019 presentation, that was what was given to me. And I'm sure that those numbers have changed since COVID hit, because we have seen it in air referrals as intervention counselors, and with substance misuse amongst our youth in our schools. We have seen a rise in that, but if there was any more current up-to-date information with the statistics from the slides, I definitely would have shared that, but that was what was passed on to me. So I apologize for not having anything more current than what I had.
And Kim, another comment was shared from that, I think from the same person, that they did just send a message to her counselor a few minutes ago and just thanking you for the presentation. And so, yes, Kim serves 2 of the Hanover County Public high schools, and then we have another intervention counselor who serves the other 2. And all of their information is on the HCPS website with the listing of those schools. So if there are other people that need to get in touch, that's the best way that you can access their contact information. And in relation to the COVID numbers, I just wanted to share, I think as a state, we're all trying to adapt and learn just, how things have shifted since COVID. And I know from a state level, many of our localities and regions are about to enter into to do some needs assessments so that we can learn more and have some of that data. And so honestly, what's being shared with you all is likely what you will also find on any state website at this current moment. And so we are definitely sharing the latest information with you all. So rest assured that that's what we have right now. And as a state, we're just looking to learn more about COVID impacts on mental health. And right now we know it's mostly anecdotal. We know the changes that are happening, but we will definitely follow up with some concrete data once those assessments are done. Another question that we have is, I think, to all the panelists. Are you all advertising 988, which should be implemented, I believe, in July? Maren, you might have the most perspective on that one.
Yeah, so for anyone that is unaware, really exciting news is that the federal 988 bill was passed, and that is going to be, as Octavia said, moved into and stated into July, which means that now instead of the longer 1-800 number for a suicide prevention hotline, the new federal hotline is 988, which is really exciting. I know that during the pilot just research study along the country that it had passed, it really greatly reduced suicide attempts when that pilot was run, just because having a quick number that is similar to 911 that can really decrease that impulsivity that can happen when someone is experiencing suicidal thoughts. And so I think that, yes, there will be a lot more media that is broadcasting that as that bill gets closer to being passed. This becomes something that is more into practice on a federal and then also a state level.
And Maren, there's another question for you. Is there anything specific that you can share that your parents did that was most helpful while you were feeling depressed?
I think that a lot of things, and a lot of them I probably would not have told you at the time. A lot I was probably extremely resistant to. Number one would be their emphasis on me seeking medical help and therapy. I was obviously at a really low spot. It was not something I wanted. It was not something I had any interest in, but they knew when to push back against me and when it was myself talking versus my depression talking. And they really pushed that I needed to get that help. And in that, I started to slowly believe them the more that I started to feel more myself. And so that, and also just their consistency. They showed up for me even when we were fighting day after day, even when they felt like they didn't have answers. Being physically present with me, even if it was tense, if it was silent, playing a very loaded game of Uno, lots of nights on days when we were all exhausted. I clearly wanted to be withdrawn, not talking to them. And so just showing up for me day in and out, even on hard days, was truly what, I'm so grateful for.
Thank you for sharing that, Maren. And then lastly, we just had a comment that was shared, and it just notes that it's currently taking days in the ER to get a child admitted to any mental health facility in the state, and that we're pretty much at a crisis level. And so it's just a kudos to you all and just thanking you all for your presentations tonight. We just wanted to share, if you go to the Hanover Cares website, we do have an emergency resource card listed here. We do have physical cards, so these are at the libraries and all the places that you would also find Lock and Talk information, but it's electronically accessible, and I think Felicia just dropped that in the chat as well, and we'll share this out. But on the site, these links are actually hyperlinked. And so if you go to any of these resources, you can directly connect to the website of that resource for more information. And so you can see from this assortment, there's lots of community partners and lots of resources, not just in Hanover, but just in Central Virginia. And then some of these are statewide and national hotline numbers as well. So definitely take advantage of this resource. And many of the resources that were shared tonight are included here, but we'll be sending that out along with the evaluation link and then any slides from tonight. So we just wanted to thank you all for being on tonight, and thank you to all of our panelists for your vulnerability, your authenticity, and just sharing ways that we can continue to keep teens safe. Thank you all. Have a great night.